You're sitting at your desk, you stand up, and suddenly the world starts spinning. Or maybe you turn your head quickly and feel like you're on a boat in rough seas. If this sounds familiar, you might be surprised to learn that the problem isn't necessarily in your inner ear, it could be coming from your neck. I'm talking about something called cervicogenic dizziness, and recent research is showing us just how connected our spine is to our sense of balance. Today, we're going to break down what this means and look at some eye opening evidence about how fixing spinal problems might actually fix your dizziness. I'm Dr. Ryan Wolfert, and what exactly is cervicogenic dizziness? The name basically means dizziness that comes from the neck. Unlike the spinning sensation you get from inner ear problems, this type of dizziness feels more like unsteadiness or feeling off balance. It usually comes with neck pain and gets worse when you move your head in certain ways. Here's where it gets interesting from a science perspective. Your neck is packed with these tiny sensors called mechanoreceptors. These little guys are constantly sending information to your brain about where your head is positioned in space. When your neck structure gets messed up, maybe from poor posture, old injuries, or just years of wear and tear, these sensors start sending confused signals to your brain. Think of it like having a GPS that's constantly recalibrating because it can't get a clear signal. Your brain gets mixed messages about balance, and the result is that dizzy, unsteady feeling. Now, here's where it gets really compelling. A study published in the European Journal of Physical and Rehabilitation Medicine followed 72 people with cervicogenic dizziness for over a year. All participants had two specific problems. They had lost the normal curve in their neck, and their head was positioned too far forward, what we call forward head posture. The researchers split them into two groups. Both groups got standard treatment, things like manual therapy, exercises, and other pain relief methods. But one group also received something called cervical extension traction using a device designed to restore the normal curve in their neck. After 10 weeks, both groups felt better. Their dizziness improved, their pain decreased, and their quality of life got better. So far, so good, but not particularly surprising. But here's where it gets interesting. When they checked back a full year later, the two groups had completely different outcomes. The group that only received the standard treatment, their symptoms had crept back up to almost where they started. Their dizziness returned, their pain came back, and their quality of life scores dropped. The group that had their neck curve corrected, they continued to improve even after treatment ended. Their dizziness scores kept getting better, their pain stayed low, and their overall function remained high. We're talking about significant differences. The corrected group had dizziness scores that were about 30 points better on a 100-point scale. What makes this study particularly strong is that they actually measured the structural changes with x-rays. The group that received the curve correction showed an average increase of 14 degrees in their neck curve. And this improvement held steady for the entire year. The control group, no structural change, no lasting improvement. The researchers also tested something called cervical kinesthetic sensibility. So basically, that means how well people could sense where their head was positioned. The group with corrected neck structure showed much better accuracy in repositioning their head, suggesting their neck sensors were working properly again. This makes sense when you understand the biomechanics. When your neck loses its normal curve and your head moves forward, it puts abnormal amounts of stress on those tiny sensors we talked about. It's like trying to get accurate readings from a scale that's sitting on an uneven surface. The information just isn't reliable. But when you restore normal alignment, those sensors can do their job properly again. The neck muscles don't have to work as hard, the joints move better, and your brain gets clear, consistent information about balance and position. Now, I want to be clear about something. This doesn't mean everyone with dizziness has a neck problem. There are many causes of dizziness, and some definitely require medical evaluation. Inner ear problems, medication side effects, blood pressure issues, and other conditions can all cause dizziness. But what this research tells us is that for people with cervicogenic dizziness, especially those with structural neck problems like lost curve or forward head posture, addressing the underlying structural issues might be key to lasting improvement. The standard approaches like exercises and manual therapy are good and they can help in the short term, but if you don't address the underlying structural problem, the benefits might not last. It's like trying to tape up a leaky pipe without addressing the underlying issue that's causing the leak. This research opens up some important questions about how we approach dizziness treatment. If someone has both dizziness and obvious postural problems, maybe we need to think beyond just symptom management and look at the bigger structural picture. The takeaway here isn't that you should diagnose yourself or skip medical evaluation if you're having dizziness issues, but it's worth knowing that your neck structure and your sense of balance are intimately connected, and sometimes fixing one can dramatically improve the other. So if you have poor posture and dizziness, and you want to find out if your poor posture is contributing to your dizziness, I'll provide a link in the description for a posture and spinal mobility assessment with me. We can do this from anywhere in the world. And as always, be your own guarantee for your health and your life.